Good morning, everybody. My name is Lindsay. I'm going to be talking to you a little bit about my experience with my interview with my informatics nurse. So I actually am a nurse over at Loma Linda, and our branch pretty much for informatics nursing, from what I noticed, is just one person, and his name is Mr. Kenneth Wenzel. He is the Electronic Health Report Application Specialist Team Lead. So quite the title, and it's mostly just him by himself that leads the program. Otherwise, there is IT that he works very closely with, and there also is the informatics specialist team, and they kind of help him out as well. So it sounds like it's a group effort. So the interdisciplinary team is a huge source of information over at Loma Linda. So I went to go meet with him last week, and I learned all about pretty much health informatics at Loma Linda, and it was ultimately very interesting, very surprising in the way that I've learned that informatics has such a huge role in our practice, pretty much in the hospital setting. From everything we do with everything with our computers, so our electronic health reporting, collecting information, the way that the educators relay information to us, as well as our general charting is pretty much directed by informatics, which to me I had no idea about. So this has opened so many doors in my mind in terms of how I understand informatics and the way that we do what we do. And it's just amazing that it's all pretty much controlled by one person, which, like I said, is Ken Wenzel. Another pretty neat thing that I learned was actually the fact that we're going to be building a whole new children's hospital wing. So we have the old one that's been around for quite some time now, and then we have our new beautiful building that's going to be built. Should be done hopefully by next year, I believe is the plan for it. So that's very exciting. I personally am in the NICU, and for the NICU, we're going to be staying in the old hospital wing, but over in the new hospital wing is going to be our tiny baby unit, which is our babies that are less than 1,000 grams. And those babies are going to be having a whole different way of charting, essentially. So their charting is going to be different. The way that their information is set up, the way that things are printed are going to need to be changed. So I learned that informatics has a huge role in that, making sure the correct labels are printed for each baby, that they have the right location. Even that when the nurses go to print, like the milk labels, for example, like, Mr. Wenzel is in charge of making sure that IT knows how to send those correct labels over to the correct printers. So to me, I know it sounds like such a simple thing, but really it's huge, because for us, that's such a big deal. Just remembering to do a milk order in general is really difficult. And then, filling it all out, making sure it's turned in on time. Granted that it prints at the right label, like it's just little things like that. There are conveniences that you don't really know who's behind the scenes with doing it, but it's them. It's informatics. So that to me was very surprising and very interesting, and I'm honestly really thankful that we have a team that's there to help us with it. Another thing that I thought was really interesting was his background. I mean, I remember reading in our notes and also in the book that that most people actually go into informatics because they have a computer background. And Mr. Kenneth Wenzel actually did have a background in computer science as well as math, and he never expected to go into nursing, but he had a professor that was in nursing, and he was inspired, and so he continued to go forth with his background. And I thought that was amazing that he chose to do that. And then he worked in Loma Linda in the ICU for several years. He also was in the ED as an ED tech, and then he worked in IT for 7 years. So he had quite the background in informatics, and then he went through the clinical informatics program over at Loma Linda. So I thought that was pretty amazing, and he's worked very closely, I guess, that him and IT, of course, because that's pretty much his team. They've worked together for many years, so they've maintained that close relationship. And then also, what I also found was really interesting were all the safeguards that informatics is in charge of following up with. So everything from scanning a barcode and scanning med and scanning our blood, they're in charge of making sure that those programs are working, and they're very interested to find out how we want to make them better, like as nurses, what we can do to improve those those methods, because we're the ones that are actually in charge of giving those, and we're the ones that are firsthand working with the patients. And if there are any suggestions that we have, he was really interested. Even like when I went to go talk to him, he was like, hey, if there's anything that you think could be changed or made better. I was like, wow, it really makes me feel like I'm a huge part of this process and a huge part of this team. And it was really amazing to me, because every day I'm scanning meds. I'm scanning my barcodes for my patients, making sure that I'm giving the correct milk. Because we scan for breast milk, believe it or not, just to make sure. I mean, that'd be kind of gross, right? To give the wrong breast milk to the wrong patient. So anyway, so basically, that it's a huge part of our team, of our role and of the team, to make sure that we're scanning and giving the right meds, the right breast milk, the right everything to the correct patient, right? It's huge. And not only that, but making sure that physicians are accountable for what they're doing as well, making sure that their orders go in correctly, that they're saying the same things and giving the same orders, and making sure that everything goes in pretty much accordingly. Even with best practice advisories that pop up. So basically, if there's, like, let's say that a patient has a pressure ulcer, we'll get a best practice advisory, just to look up like what suggestions are, what we're doing to change those, what care plans should we be charting on, what education should we be doing for the patient and for the family. So those are all like our best practice advisories, and it's all just for patient safety. And that's what I realized is so important for healthcare informatics, is they really help us push that patient safety going forward. Making sure that we're meeting that criteria and that we don't get cited is huge too. I mean, of course, like, why would we want to get cited for something that we could make changes on, right? So informatics is huge on making sure that we're following those guidelines, right? And not getting in trouble for doing something incorrectly. Not only that, but that our charting all pops up the same way. So like basically there's certain patients, obviously, if they meet the category of being the male gender or the female gender, like our charting will pop up for us like that, because we have to chart, like for example, for us in NICU, like we have to chart like, is the genitalia intact? Like, is there something that's going on that's abnormal? Because sometimes you'll have a baby that's born, with an imperforate anus, or maybe like they're, maybe they don't have the correct genitalia that's, appropriate for that gender. So there's stuff like that that we need to chart on, or if there's something else, that's going on with it. So that's just an example, like in my field, that Kenneth Wenzel also brought up, that is different for our charting, and it's basically across the board for every hospital, that it's the charting will pop up differently depending on what the patient's needs are. Same like if the patient is getting blood, you're going to have that little barcode at the top of the statement or of your charting that talks about, like the blood when you gave it, or even IVs, because if the patient has an IV, it's policy to chart it every hour. So it's important that those policies are followed and that you're charting based upon those policies, and that the charting pops up for you when it should. And if it doesn't, you need to contact IT or contact, Mr. Wenzel, and they're more than happy to help with that. So I just thought that that was very neat. So all of that charting will automatically pop up, and they have it programmed that way just to make sure that you follow all of that required documentation, which is huge, because that's what our policies state. That's what we're being looked at, essentially, to make sure that we're not cited. Another huge thing that's really important for Loma Linda right now is going through the magnet process. So very exciting. We have quite a great team that's working on that. And essentially, Mr. Wenzel is in charge of kind of advising those people, like letting them know, what documentation needs to be done, show the nursing workflow, do like the professional work week, like he was telling me about, getting together with people, making sure they know what changes need to be made and how they need to be happening, as well as putting committees together to make sure that, everybody's on board, and like making sure that, data is being collected correctly and that it's being presented so that way people understand what's going on. So we actually did just recently, this last month, submit for Magnet, and I guess it takes about like a year or so to figure out whether we received Magnet or not. So that's kind of exciting. And he has such a huge role. I mean, like if he's the one that's going to be, giving them the data that they need and giving direction, that's a lot of responsibility, if you think about it. let's see. Okay, so the other thing that I wanted to talk about was so the challenges that he had faced. Like I always feel like that's such a great and pertinent question to ask people because you want to hear about the challenges that they face, why they've made the decisions that they have. Is it because of, a struggle or, just you want to hear about how people go about, confronting, different issues. Because that sometimes issues are inevitable. People have different opinions, and it's important to understand, how to work together with the interdisciplinary team, right? So basically he was telling me, like sometimes physicians will make some last minute changes and they won't really understand how the process works, and they kind of tend to go about doing certain processes before they even confront him and ask like, hey, how should I do this? So he says that it's kind of important that when dealing with other disciplines that you let them know like, hey, please, before you make a decision, come to me first, talk to me about it, because technically like some of these decisions could have been solved or taken care of with confronting IT or with confronting me. We could have kind of worked together to get this role accomplished because we're all a team. So kind of making sure everybody's aware of what the role is of informatics, to make sure people are educated, is one of the biggest ways to kind of remove some of those issues from happening, and working together as a team is of course always very important. And now in terms of like how this will impact, me as a master's prepared nurse, basically it allows me to understand like how we work together as a team. How if there's an issue that I have that happens to occur, like if I need to understand like how to teach other nurses, for example, how to chart something, if I have some kind of issue with the electronic health report, or if, certain charting isn't popping up, I know who to contact, because all of that is important for our required documentation. And as an advanced practice nurse, half the time you're educating other nurses how to do their roles. Whether, you're, doing education or whatever it is, you need to make sure that you know who to contact when you have something that goes wrong or something that happens. And that's pretty much how it helps me. So how to work with technology and how to educate others, essentially. Let's see. So ultimately, I'm really thankful I had this opportunity to interview an informatics nurse. I thought this was a really great idea because it allowed me to kind of meet the person who it was in, informatics, and learn about how it actually happens at our hospital. So thank you for allowing the opportunity for us, and thanks for taking the time to listen.